Hola, bienvenidos a todos. Bueno, mi nombre es doctora Gómez Aguirre Karina. Soy médica toxicóloga especializada en toxicología ambiental y bueno, y tengo el gran placer de representar a ICAS Argentina. Y en esta oportunidad vamos a contar con la participación del doctor Paul Wax, quien vive en Phoenix, Arizona, en Estados Unidos, que ha sido el director ejecutivo del Colegio Americano de Toxicología Médica, la ACMT, desde el año 2008. Y antes de su servicio como director ejecutivo, el doctor Wax formó parte de la junta directiva desde el año 1998 al 2008. El doctor se licenció en Dartmouth College y se doctoró en medicina en la Escuela de Medicina de Mount Sinai de New York, y desde la Escuela de Medicina completó su residencia en Medicina de Emergencia en la UCLA y una beca de toxicología médica en la Universidad de New York. El doctor Wax ha sido profesor en los departamentos de Medicina de Emergencia de la Facultad de Medicina de la Universidad de Rochester y de la Facultad de Medicina de la Universidad de Arizona. Actualmente es profesor adjunto de Medicina de Emergencia en la misma Facultad de Medicina de la UT de Southwestern en Dallas, Texas. Y en el año 2019, el doctor Wax recibió el premio a la trayectoria profesional en toxicología médica del Colegio Americano de Toxicología Médica. Desde el año 2023 al 2024 se desempeñó como miembro del Comité de Toxicología de las Academias Nacionales. Bueno, le damos la bienvenida a esta presentación y en este espacio. Muchas gracias, doctor Paul Wax. No sé si quieres decir algunas palabras o directamente ya nos dirigimos al video que nos preparaste para esta presentación. A los organizadores, si podemos ir al video.
Introduce to your society RETOXLAC, and it's really been delightful to get to learn about your association. I've been the executive director of the American College of Medical Toxicology for over 16 years now. It's been a real privilege and honor. And prior to that, I was on the board of directors for 10 years, beginning in 1998, and serving as president from 2006 to 2008. Over the years, I've gotten to know those in medical toxicology from around the world, and this has been very endearing to me personally, and also a great learning experience as I learn about how other medical and clinical toxicologists practice medical toxicology. These are some of the associations that I've had the chance to work with. One of our most recent endeavors is to try to develop a confederation of societies across the globe in medical toxicology so we can communicate and continue to learn from one another. Today, I will be covering the following topics. I'll introduce you to ACMT, which is the American College of Medical Toxicology, and then I'll talk about education and training, starting by discussing our fellowship programs, and then discussing conferences, webinars, our learning center, and the importance of partnerships. The American College of Medical Toxicology was founded in 1993 as a professional nonprofit association of physicians with board certification in medical toxicology. But we also have other members with advanced training in this area who may not have board certification. And our members tend to practice in the clinical, academic, government, and/or public health settings. And many of our members also provide poison control center leadership. Our new mission plan for ACMT is as follows. We have the mission to advance the toxicological care of patients and populations and advocate for our specialty of medical toxicology. And our long-term vision is that every patient and population benefits from the expertise of medical toxicologists. Our core values include that all patients receive the highest quality of care, that medical toxicology becomes an integral part of the healthcare system, that education, research, and translation are imperative to improve patient care, that leadership, innovation, and advocacy are essential to advancing medical toxicology, and that members are our strength. This is our current board of directors, distinguished leaders in medical toxicology across the United States, and I am indebted to their leadership for providing me with the opportunity to help lead the society. Over the years, we have been blessed with the opportunity to grow our staff, who all contribute to the mission of the American College of Medical Toxicology. We'll talk briefly about our research program, which is run by our toxic staff, but we also have staff involved with membership and education and marketing and communication. And it's through the hard work of our staff that we're able to push forward with developing our programs and trying to meet our mission. The ACMT family includes several entities that work hand in hand with ACMT and are part of ACMT, including our Toxicology Investigators Consortium, known as TOXIC, our Journal of Medical Toxicology, and our Medical Toxicology Foundation. TOXIC, which is our Toxicology Investigators Consortium, was started in 2010 and involves many of our members on a number of different projects. Projects that include work within the US, but other projects which have international collaborators as well. This is our homepage of our website for TOXIC, and it highlights several of our projects, including a project looking at naloxone use in the pre-hospital care system, projects looking at the fentanyl epidemic in the United States. We have a snakebite project, and we also have our core registry project, which was our initial project, which we've continued now since 2010. This is a map of the US sites that participate in our toxic registry, but we also have several international sites in Thailand and in Israel and in the UK and in Canada. And we welcome others who might want to participate in this patient registry to join our endeavor. We have now approximately 105,000 cases in the registry, and these all have been seen by a medical toxicologist at the bedside. So this is distinct from a poison control system where there are telephone cases. These are all cases where a medical toxicologist has examined the patient and provided consultation at the bedside. And it serves as a very rich database. We publish an annual report each year. This is the report that just came out just a few weeks ago about our 2023 experiences. And we also are involved with multiple research projects. This is just a sampling of some of the papers that were published in 2024. And these all come about through our Toxic Investigators Consortium and through the hard work of our members who participate. We also have a journal, the Journal of Medical Toxicology, which has grown in stature over the years. and it publishes many papers of original research, as well as other papers of interest to the medical toxicology community. And this journal continues to grow in influence and has been an important component to ACMT. We also have a foundation, which is apart from ACMT, the Medical Toxicology Foundation. It's a charitable organization that raises money to provide research grants, small research grants to members, and to support a number of educational initiatives. Currently, ACMT has a little less than 930 members. The full members are members who are board certified in medical toxicology. They're all physicians who've done a medical toxicology fellowship. We also have affiliate members who are physicians without that formal training, or others who are not physicians but with advanced degrees, such as those with PhDs or pharmacy degrees. We have in training residents and some medical students, and we also have a number of international members who have joined ACMT over the years, which we greatly appreciate. We're now the largest toxicology, clinical or medical toxicology organization in the world. Regarding how one gets into medical toxicology in the United States, it's a fairly rigorous process. Members initially will go to university, where they can study anything. They do not have to be a science major, although many of them are. And that's followed by 4 years of medical school. Once they get their medical degree, they typically do a residency in emergency medicine, although some of them do residencies in pediatrics or internal medicine or even psychiatry. And that generally goes on for another 3 or 4 years. And then they do a full-time fellowship in medical toxicology for 2 years. And after that, they're eligible to sit for the board certification exam in medical toxicology. This is a slide showing the 33 programs in medical toxicology across the United States. The number of fellows have slowly grown over the years, and we currently have 113 fellows across the 2 years of training at these various institutions in the United States. The curriculum for the medical toxicology fellowships to some degree follows the curriculum set forth by the American Board of Emergency Medicine and its co-boards from pediatrics and preventive medicine. And a core content is published, which outlines the topics that constitutes medical toxicology. And this has been updated several times over the years. This is the most current version. And this content has numerous topics. This is just a sample of topics that medical toxicologists are responsible to master over their training in medical toxicology. ACMT offers a board review course. The examination is given every 2 years. And this board review course, which has just been given over the last couple of months now, is to help prepare those who have finished fellowships to sit for the exam in medical toxicology. This is a slide just showing some of the topics that are covered in this board review course. This year, we did it a little bit differently. We did a course which was online with a so-called flipped classroom approach, where the students or the fellows and others taking the course studied on their own with the materials that we provided, and then we had interactive cram sessions to help prep them for the examination. We also had a number of resources that we developed, including a quiz bank of almost 1,000 test items and flashcards and study materials. So to discuss some of our other continuing education over the next few slides, ACMT has an annual meeting, which is called the ACMT Annual Scientific Meeting. We've been holding these meetings since 2002. We have them in the spring. There's another U.S. meeting, the North American Congress of Clinical Toxicology. That's put on by a different organization, the American Academy of Clinical Toxicology. And that meeting just wrapped up this past Monday. It was a very successful meeting in Denver, Colorado. But our meeting is in the spring, and our next meeting happens to be in Vancouver, Canada, in early April. As part of that conference, we generally hold several full-day symposia immediately preceding the research part of the conference. And this coming year, we're going to be having a symposia on harm reduction and the management of substance use disorder, or SUD. And we're also going to be holding a symposia on occupational and environment. Our members are generally focused to a significant degree with emergency toxicology, but the scope of toxicology certainly includes occupational and environmental toxicology. And this is a course for some continuing education in that domain. ACMT also puts on a series of webinars. In fact, we put on pretty much a webinar a week. These webinars are free to our members, and they're each a little bit different. We have our addiction toxicology case conference on the first Friday of the month, which goes over interesting cases in addiction medicine and addiction toxicology. We have our national case conference, which is a monthly conference that goes over interesting medical toxicology cases. We have our grand rounds, which are fellowship programs rotate on putting on, and these go over some of the recent literature. And then we also have a journal club. I'm sorry, the journal club is where we go over the interesting papers, and the national grand rounds is where we invite a speaker to present on an interesting topic. So these webinars are free to all of our members. Another course we put on is our Total Tox course. This is a bit different than our board review course. This is aimed for those who might not be medical toxicologists, but are interested in learning more about medical toxicology. Its target audience is for emergency physicians, other types of physicians, pharmacists, advanced practice nurses, EMTs, those who work in poison centers or in laboratories. And this is on demand, so you don't have to travel. The upcoming dates for this course, it's taught over 3 different days, but it's also on demand. And if you missed a day, you can get all the materials online. And this is a course that some of our members take as well, because it's a great refresher course. We've also developed several other courses over the last several years. This was a course we developed last year called Pathways to Building and Sustaining a Medical Toxicology Practice. There was a lot of interest from our members about figuring out, how does one build a toxicology practice? And it can be very challenging. The majority of our members work in areas outside of medical toxicology as well. Many of them work in the emergency department. But this was a course designed to provide some skills and share some examples of how to develop a medical toxicology practice. This was a symposia that we put on at our prior conference, annual conference this past April in Washington, D.C., about substance use disorder in adolescents and young adults. And what we do is we record these conferences, and then we provide access to them in our classroom, which we'll discuss in a minute. In fact, on the next slide. So our classroom is known as our Learning Center, and this is a learning management system software which is able to archive and inventory all of our education, whether it's been delivered in a live conference setting or by webinar. And over the years, we've built up a very substantial inventory of, I think, really good educational content that members and others can access through our Learning Center. This is another snapshot of some of the information on our Learning Center. You can see where you can get access to our webinars, our Total Tox course. Our Antidote Institute is an interesting program that we're running for junior researchers. And you can also search for various topics that we've developed by topic, as you can see in the left hand part of this slide. We also, ACMT, as part of our efforts to develop new researchers, we sponsor a series of research programs to develop research skills. This is a program through the National Institute of Drug Abuse, which has pushed out some mentor-facilitated training awards. And this program just started a couple of years ago, and we've had some fellows in training take this initiative, and we have another cycle that's closing next week. We, as mentioned, have this Antidote Institute, which has been developed by several of our members, that was also funded by the National Institutes of Health. And this is to provide research skill development, generally for junior faculty. And this was just initiated about 3 years ago with the grant that they got from NIDA, which is very exciting. We also have a research forum at our general meeting where typically fellows in training put forth research aims, and then they put together a grant and they present their proposal to the at the conference, and a winner is then awarded with an actual research grant to do the research. We also offer an elective for medical toxicology fellows in industry, so they can have an experience learning about medical toxicology in industry. It's a 1-month elective, and it provides an experience that they generally don't get during their medical toxicology fellowship training. We also offer some research grants on top of what we've previously discussed. This is a partnership with the Society of Academic Emergency Medicine, and we annually solicit applications for this research initiative. To tie all this together, we have a communications department. We have a website that tries to provide as much of this information as possible, which is acmt.net. We have a newsletter, as you can see on the right side, and we just developed this new interactive platform called ACMT Connect, where members can interface with one another online. We also participate in a variety of social media endeavors as well. Finally, for those who like creative toxicology gear, we've teamed up with a store to provide toxicology merchandise for those who might be interested. And some of these shirts and coffee mugs are pretty cool. So finally, on the second to last slide is just our ACMT website. Again, acmt.net. I invite people to look around at the website. There are a lot of quick links. There's a lot of news. You can learn about our educational content, and you might find something of interest. Lastly, regarding continuing education, we do provide continuing education credits for those that need such credits. And we've expanded now not only to provide credits to physicians, but also to pharmacists and to nurses, as we feel that they also may be quite interested in learning more about medical and clinical toxicology. On this note, I'd like to say thank you and gracias. I very much appreciate the invitation to speak, and I hope that we can collaborate in the future. If anyone has any questions, you can contact me specifically at Paul, Paul.wax, WAX, at acmt.net. Thank you very much.
Bueno, muchas gracias, Paul, por tus palabras. Realmente han sido muy ilustrativas de toda la actividad que tiene la American College en los Estados Unidos, y la verdad que ingresando a la página, la verdad que es extensísima la cantidad de actividades que realizan y los tópicos que abordan desde el abordaje, obviamente, de las distintas ramas de la toxicología.
Thank you, Paul. Thank you very much for your inspiring presentation and for sharing with us all the vast and rich experience of ACMT in training and research in so many areas and aim it at so many professionals, including medical toxicologists.
Hmm.
So um, I have two questions for you here. One is, well, it's regarding the core contents of medical toxicology training. And I, we would like to know your perspective about which items or topics were the most recent added in the core content. Um, because we the toxicologists, we have a long experience in epidemiology and problems with poisons has been changed a lot. And this is my first question. And if you want to give us your perspective about if there is any topic we need to add nowadays.
Well, thank you for the question, and thank you for the opportunity to present today. I greatly appreciate the opportunity and hope to continue to interface with my colleagues from um, Central and South America. Regarding the specific question about the core content, I had the privilege of being involved with writing the first core content that was published in 2002. And over the years, the content has been revised. And what has been recently added includes content um, uh, that is pertaining to addiction medicine, or what we call addiction toxicology. Um, with the treatment of opioid use disorder with buprenorphine and other treatments, it's really opened up, I think, new horizons for medical toxicologists to get engaged. We do also have a specialty in the US of addiction medicine, which is a little bit different than medical toxicology, but there's a lot of overlap. And many of our members have become experts in the treatment of patients with substance use disorder and opioid addiction. And they've been prescribing buprenorphine and taking care of patients, some of them in the outpatient clinic, which is different than the more traditional um, treatment through a poison control center or in the emergency department. So that's certainly been one change. Some additional additions to the core content include emphasis on forensic toxicology and the understanding of the laboratory. It's my personal belief that the medical toxicologist plays a essential role in the interpretation of toxicology tests. And while most medical toxicologists are not working in the laboratory performing the test, as clinicians with expertise in toxicology, they certainly can help translate the tests for other healthcare providers who often have very limited knowledge of toxicology testing. And so, further expertise in the interpretation of toxicology testing is very important. And the third area that we've expanded upon in recent years is in occupational and environmental toxicology. These are the sorts of topics that don't necessarily present to an emergency department or not generally calls in a poison control center, but are an important part of the continuum of medical toxicology, low level environmental exposures and occupational exposures, and so we've tried to provide some increase emphasis on that as part of the core content.
Thank you, Paul. Bueno, le preguntamos a Paul sobre los contenidos centrales de la formación en toxicología médica y en referencia a la publicación que él presentó, el último en 2021, un consenso de la Asociación, el Colegio Americano de Toxicología, y él le preguntamos fundamentalmente cuáles eran los ítems que se habían agregado más recientemente o cuáles pensaban que tenían que ser fortalecidos o agregados en la actualidad. Y su respuesta nos menciona que lo que cambió desde el 2002 al 2021, él participó en ambos consensos, es el tipo de consumo, problemas de consumo de sustancias, fundamentalmente debido a la aparición de los opioides y a opioides que son diferentes a los clásicos, y también aspectos de lo que llaman toxicología de las adicciones, que en realidad tiene aspectos muy particulares en el tratamiento de los pacientes, pero que tiene obviamente un área en común con la toxicología importante. Luego menciona la toxicología forense y particularmente la toxicología analítica, en términos de los nuevos desarrollos para los análisis toxicológicos, y menciona la importancia en el entrenamiento para interpretar esos resultados, fundamentalmente desde su origen de toxicología analítica llevado a la clínica, a la traducción de esos datos a la práctica clínica. Y en tercer lugar, destaca la toxicología ocupacional y ambiental como un área que también está hoy siendo central a la formación de los toxicólogos clínicos, porque no solamente es un tema de la emergencia toxicológica, sino que integra todo el accionar de la clínica médica. Gracias, Paul.
Había alguna preguntita que estábamos teniendo sobre la oportunidad, digamos, de los médicos toxicólogos de poder acceder, ¿no es cierto?, a las capacitaciones que el American College ofrece. In this case, Paul, we have a question that they asking the possibility that toxicology physician from Latin American could be the possibility to study in the American College. What are the chances to study in the space that you can share us?
Sure. Well, thank you for the question. In terms of formal toxicology training, as I mentioned, the 2-year fellowship programs, there are several programs that have taken international students for their toxicology training. If they have not done their primary medical training in the United States, they're not eligible to take the board certification examination. But there are several programs that have taken international fellows, for the traditional 2-year training program, which is a full-time position. Apart from that intensive 2-year training, we offer as the college a variety of educational opportunities. Some of them are available for our members, and we do have international members, as I mentioned. and they pay reduced dues, and they then have the opportunity to participate in many of our webinars, which are free for members. And as mentioned, we have a webinar almost every week in addiction medicine or general toxicology, or we have journal clubs as well, and other resources in our learning management system. And then we also have our conferences and courses, which are available for a registration fee, but they're not only provided live, some of them, but also they're recorded and available through our website or on-demand listening. And so one could listen to them at any time on their own schedule.
Bueno, nos comentaba Paul que, bueno, evidentemente hay una metodología, digamos, para aquellos profesionales americanos, ¿no?, de poder acceder a las capacitaciones, pero independientemente de ellos, la capacitación en toxicología es un espacio que dura 2 años, pero que en el caso, digamos, de los profesionales internacionales que podamos tener accesos a las inscripciones, podemos acceder a cursos, webinarios, conferencias, digamos, con un arancel mucho más reducido, bueno, que nos permitiría obviamente poder acceder en forma mucho más sencilla. No sé si vos entendiste algo más, Amalia.
No, perfecto.
Bueno, y otra preguntita que yo quería hacer, que tenía que ver con la mirada de la American College respecto de las evaluaciones de riesgo, ¿no?, que es algo que nosotros para el continente latinoamericano es una herramienta que estamos trabajando mucho. In this case, Paul Watts, we want to ask you about the risk assessment that we have using in Latin America, like strategies to try to understand the problem from the environmental who potentially affect human health. What do you think about that?
If you could just reframe the question about how one approaches environmental toxicological impacts on human health.
Yeah. Mm-hmm.
Well, go on.
I think that the question it has to do more with risk evaluation, toxicological risk evaluation of new chemicals or products, or how ACMT interact or do on this kind of evaluation for decision makers. And
yeah, I think that's a very important question. Part of it, I think, is to continuing to educate our members about how to best understand these environmental health risks. I think many of our members, even though they're medical toxicologists, their education and emphasis has been in overdose and acute poisoning, and they don't have as much experience with understanding environmental hazards and low-level toxic exposures. So what we have done at ACMT is try to provide some education to improve the knowledge of our members regarding environmental toxic exposures. We recently actually just received a grant from the Center for Disease Control to do more education of our members about the interface between medical toxicology and public health. There are very few medical toxicologists in public health, and an awareness of the fact that we do have this physician specialty of medical toxicologists is important. Despite our successes, many physicians and public health authorities in the U.S. are still not aware of medical toxicology. Continuing education to others outside of our specialty and the development of the skills within our members on environmental health hazards is very important. And one more thing I should say, that as physicians, we are unique in that we have some understanding of these environmental toxicological hazards, while most physicians have no experience. And so it's important for us to help translate to other healthcare providers about our assessment of these risks.
Bueno, no sé si querés comentar vos, Amalia. Bueno, simplemente lo que nos está comentando el doctor Paul Wax, que es una herramienta que digamos que para los médicos es algo más bien innovador y que bueno, están trabajando en ese sentido para obtener mayores capacitaciones, a pesar de que él tiene conocimiento de que obviamente las autoridades reguladoras están requiriendo este tipo de conocimientos, pero que bueno, están trabajando en ese sentido para que muchos médicos, sobre todo de las ciencias ambientales o más afines a las ciencias ambientales, puedan hacer el abordaje, ¿no? de esta temática. No sé, Amalia, si vos querés agregar algo más.
No, nada más. Muchas gracias. Solo agradecer mucho a Paul, a ti, Karina, por estar en esta coordinación. Ha sido un placer. Y realmente...
Igualmente, Amalia. ¿Sabes lo que te quiero? Y bueno, yo a Paul, que lo conozco hace poco, también le tengo mucho respeto, es una persona muy prestigiosa, y bueno, el agradecimiento es mío de que ustedes me hayan permitido también formar parte de este espacio con ustedes y compartirlo.
Okay, we are comment, Paul, that we are very grateful for having the opportunity to be here coordinating your presentation. It was really a pleasure to learn from you, and thank you on behalf of SIBSA and RETOXLAC's Congress for being with us and share your experience. Thank you so much, and I hope we see you soon in other toxicological activity.
Well, I would just like to thank the Society for inviting me, and let's continue to dialogue. I apologize for my lack of Spanish, but there are a number of U.S. medical toxicologists that are fluent in Spanish, and they would particularly enjoy interfacing with your group and your members. Thank you very much.
Thank you.
Thank you, Paul. Thank you, Amalia.
Bueno, nos despedimos entonces.
Nos despedimos entonces. Muchas gracias a todos los que nos estén escuchando.
Okay.